All right, so now we're going into Module 7. In Module 7, we want to talk about social insurance, and we want to take a look at these additional accident and sickness insurance concepts. Now, we first start off by looking at topic 1, which is social insurance. And social insurance is a big part of our exam because we really want to take a look at Medicare, Medicaid, Social Security, and what they cover. And so we first start off at Medicare. So Medicare is a federal health program primarily for individuals age 65 or older, but it can also cover certain younger people with disabilities. And we'll take a look at in a moment at what that means. Okay, but we first want to take a look at the parts of Medicare, and we must make sure that we memorize what are the parts and what do they cover. Okay, so with our part A, it covers mainly inpatient care. So inpatient care, right? Skilled nursing facility care. We mentioned that with long-term care earlier. Hospice care, right? That's also an example of long-term care. And some other types of like home health care, right? And so this is mainly right for inpatient care, right? Within the hospital, right? Or within some like medical setting. Part B covers outpatient care, right? So it covers lab testing, we can ambulance services, right? Preventative services. All of this is outside of a traditional right, hospital or medical setting, but it's still very important, right? Because all of these can also, right, rack up a lot of cost for the insured. So this federal program, right, is important to cover these outpatient costs as well, right? So with Part C, we'll look at our Medicare Advantage plan. So they're also called Medicare Advantage plans. And these are Medicare provided with an approved HMO, Health Maintenance Organization, or preferred provider organization. So remember, these are private insurers, right? These are these private insurers, right, that partner with Medicare. And so, right, as I said, these are coordinated plans that generally offer people with Medicare additional benefits, right? So they might cover more comprehensive types of, right, for comprehensive preventive services, they might cover more comprehensive illnesses, right, that one might have, okay? So what we want to know about Part C is this is a type of coordinated care plan, okay? And it is provided through private insurers, right, such as HMOs, PPOs. Now, when we take a look at Part D, right, it's really simple to memorize because we can look at D and drug, right? These are prescription drug coverage plans. So Part D of Medicare helps to cover the cost of prescription drugs. So anytime, right, one heads to the pharmacy, right, they are utilizing, right, Part D of Medicare, right, to cover those prescription drugs, right? As long as they have Medicare in the first place. Okay, so we've reviewed through, right, Part A, Part B, Part C, and Part D of Medicare. And it's important that we, right, review through the parts of these, of Medicare in general and what they cover, right? Inpatient care, outpatient care, right? Drugs or coordinated care. Our Medicare supplement policies. So Medicare supplement policies are different from Medicare Advantage. So Medicare supplement policies, or it's also called Medigap, is extra insurance you can buy from a private health insurance company to help pay your share of out-of-pocket costs in the original Medicare. So the important part to know is that Medigap is different from Medicare because you must have original Medicare to buy a Medigap policy. And so with our Medicare supplemental policies, something that we do want to know is that the policy must be issued regardless of a health status during open enrollment period. Now, the open enrollment period for Medicare supplements begin 3 months before your 65th birthday, and it lasts for 7 months. Okay. Now, what we also want to know about Medigap is that the free look period for Medicare supplements is 30 days. Okay, so typically we know that from traditional policies, it's usually 10 days. But with Medicare supplements, interestingly, it's 30 days. So it allows one, right, to give them extra time to look over the policy and decide whether they should keep or not keep the policy. Now, when we look at pre-existing conditions, right, the insurer may exclude coverage for pre-existing conditions on a Medicare supplement policy for up to 6 months. Okay, so these are kind of some of the specific things we want to know about Medicare supplement / Medigap. So they are basically the same. And so in many states, right, they do have a specific section in the state-specific, right, content outline guide that has what you need to know about Medicare supplement. But in general, these are the major points that we want to make sure we know, right? That it's extra insurance you buy from private health insurance companies that help, right, to supplement, right? Think about Medigap, right? It kind of fills the gap, right? It provides a supplement on top of your original Medicare. Right. So the next major program that we want to look at, besides for Medicare, right, is Medicaid. So Medicaid is different from Medicare. Medicaid is part of the Social Security program that helps to supply needy people with assistance plans, right? Regardless of their age, right? Helps these people get back on their feet, helps these people who are in these underprivileged areas, and it provides them with these funds, right? And it's funded by both the federal and the state governments. Okay, it's funded by these federal and these state governments. Now, with Medicaid, there's not like Part A, B, C, or D like Medicare. Okay, so Medicare, we did need to know those, but for Medicaid, we don't have those parts. Okay. And then lastly, right, our third major social insurance program is Social Security itself, right? And so with Social Security, I want to know first, what are the eligibility requirements? So with eligibility, first thing I want to know is work status, right? Our work status. So we know that depending on the number of credits one has obtained, right, it helps to categorize on whether or not an individual will receive more Social Security credit benefits or fewer Social Security benefits. So when we take a look at the full insured status, right, this is where a covered worker must occur a total of 60 or 40 quarters of credit. So that's more or less about 10 years of work, right? So we can just approximate that 10 years of work that provides one with these fully insured status. Now, if a worker has earned 6 credits during the last 13 quarter period, they would be considered a currently insured. Now, we don't really need to know, right, the number of years they've worked. We do need to know, right, that we have 2 statuses, the fully insured status and the currently insured status. And, right, this is an eligibility requirement on qualifying individuals for certain levels of benefits. Now, when we take a look at other eligibility requirements, right, we should also know that we have age, right, as well, that plays into a role. We also have income, right? So we'll take a look at that now. So if we look at first on earnings, right, why does earnings matter? Well, because what we want to know is Social Security is funded by the FICA payroll taxes, right? They're funded by payroll taxes. So the more an individual has earned, as determined by the PIA, right, the more they would earn or have, right, or receive for retirement or during retirement. So Social Security is correlated with, right, one's earnings, because the more one has paid, right, the more one has earned, the more benefits that they will receive. And the PIA is determined through a calculation that corresponds to a person's average index monthly earnings, right? And so we can see why, right? If we contributed more to it, then we would be receiving more when we retire. The last thing we're going to look at is age, right? So with retirement age and when we can receive retirement benefits, it all depends on when we start to receive benefits at first, right? So are we going to start deciding to, all right, I'm going to start receiving benefits at age of 62, or maybe, you know what, I might wait a couple of years and start receiving these benefits at 70. And we can see that depending on the age, right, that you start receiving Social Security benefits, you have different percentages, right? Social Security benefit percentages. Okay, so here's something interesting. You don't need to know specific percentages, but we just need to know age in general is a factor, right, on how much you receive. Okay, so to summarize, we have our work status or credit, we have our earnings, and we have our age. All right, so that all correlates to retirement, right? Retirement. So those eligibility requirements, right, help to dictate during retirement how much an individual will receive, right? So now with Social Security, right, it doesn't just cover individuals who are in retirement. And that's very interesting because many students think about that Social Security only covers retirement, but it actually also covers disability and survivor benefits too. So let's start with disability. So for eligibility requirements with that, right, individuals who cannot work at all, right? That's the key thing. Individuals who cannot work at all due to medical condition, and the disability is expected to last at least 1 year, right? So it is more of a permanent, right, or more severe disability. They're able to receive disability benefits. But another eligibility requirement is that they should have sufficient work credits, right? Depending on the age at the time of disability. And so we do have, right, Social Security Administration does have specifics with that. But we don't need to know all of those. We just need to know that with disability, right, it has to be more of a permanent disability and it requires sufficient work credits. Now, these benefits have a waiting period. They have a waiting period. And so just like when we talked about health insurance, or we talked about the probationary period, right, Social Security benefits also have a waiting period, right? And that the benefits will not begin before the 6th full month of disability, right? So again, it helps to the policies that are implemented to control risk, right, and ensure that these disabilities are permanent, because this is the benefit that is provided by the federal government. And lastly, we have survivorship benefits, right? So eligibility is through, right, family members of deceased workers who've earned enough work credits. So depending on, right, the age of family members, right? Occupation and deceased workers, and the work credits that they've earned, right? Then we then the family members could possibly receive survivorship benefits too. So have retirement benefits, disability, and survivorship benefits. And what we want to know about them is that Social Security benefits in general are usually taxable. We don't really need to dive into that, but just kind of as a general thing, Social Security benefits are usually taxable. Okay, so now let's go ahead to answer some questions to review through our Social Security concepts. For number one, right, Medicare supplement policies are designed, in this case, right, remember they're called Medigap, right, or Medicare supplement policies. These provide additional benefits beyond this provided by Medicare, right? So they provide these additional benefits, right? They are you supplement, right? They fill in the gaps of Medicare. Number two, a group long-term disability plan is integrated with Social Security. And which of the following statements is correct? So when we look at this here, we really want to think about what we've talked about earlier in the previous provisions. When we took a look at integration, right, and duplication of benefits. And so whenever we have a integration with disability plans and Social Security, right, in which both could provide one with disability payments, then Social Security and group payments usually pay combined maximum limit. Okay, so this will overshadow into our next topic where we talk about some of those additional concepts too. But it's really good to keep thinking about whenever we have two plans that cover right disabilities or cover the same condition, right? Then they would combine pay like a maximum limit to avoid duplication of benefits. Right. Go ahead and try questions 3 and 4, and then we'll go over it in a moment as well. So for number 3, right, we know that Social Security provides programs for retirement, so provides benefits for survivors, provides benefits for disabilities, but doesn't provide benefits for workers' compensation. And next topic, we'll take a look at what that means. What is workers' compensation? But remember, we have 3 major benefits that Social Security provides, and that's retirement, survivorship, and disability. And for number 4, to be eligible for Social Security disability benefits, an employee must be able to perform, right? In this case, it would be, right, any occupation and have sufficient work credits. So if you go back to review the RUE, what are the eligibility requirements for a disability, right? They must not be able to work at all, right? So they can't perform any sort of occupation, right? And they must have sufficient work credits depending on their age. So in that case, they don't necessarily need 40 credits. It really just depends on the time of disability, their age, right, and how much they could have earned. And so someone that becomes disabled at 18 might be different, might need to have different work credits than someone who becomes disabled at age of 40, right? So it really just depends on that. But again, if we just look at this in general, right, it would be any occupation and having sufficient work credits.